Ladies and gentlemen, Assalamu alaikum and a very good morning. Welcome to day 2 of the IGHD Annual Conference 2025. We are delighted to have you with us once again as we continue our important discussions on climate change, resilience, and the built environment. Today's program begins with Session A, which explores urban planning for climate solutions, a theme of growing urgency for rapidly expanding cities across Pakistan and beyond. Before we begin, may I kindly request all our guests to please take their seats and ensure that their mobile phones are set to silent. Thank you. We will now begin with the recitation from the Holy Quran.
أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم خلق الإنسان من صلصال كالفخار وخلق الجان من مارج من نار فبأي آلاء ربكما تكذبان رب المشرقين ورب المغربين فبأي آلاء ربكما تكذبان مرج البحرين يلتقيان بينهما برزخ لا يبغيان فبأي آلاء ربكما تكذبان يخرج منهما اللؤلؤ والمرجان فبأي آلاء ربكما تكذبان وله الجوار المنشآت في البحر كالأعلام فبأي آلاء ربكما تكذبان. In the name of Allah, who is most merciful and most gracious. And He created man from the dry rotten clay like the potters, and He created jinns from the smokeless flame of fire. So which of the favors of your Lord would you deny? Lord of the two east and Lord of the two west. So which of the favors of your Lord would you deny? He let loose the two seas that they may meet together. Between them is a barrier which they do not transgress. So which of the favors of your Lord would you deny? From them come out of pearls and corals. So which of the favors of your Lord would you deny? And his are the ships raised up high in the sky like mountains. So which of the favors of your Lord would you deny? Sadaqallahu al-Azim.
Thank you, Abdullah, for that beautiful recitation. Now, to lead us through the first session of the day, it is my honor to introduce our two chairs. Ladies and gentlemen, our first chair for Session A is Dr. Stephen M. Leon. Dr. Leon is the inaugural dean of the Faculty of Arts and Sciences at the Aga Khan University in Karachi. A cultural anthropologist, he specializes in the intersection of culture, politics, and resource management in the rural and urban areas of Pakistan. He has published widely on these subjects, including political kinship in Pakistan, descent, marriage, and government stability. Dr. Leon has also served as editor-in-chief of the Social Science Computer Review until 2024. Please join me in welcoming Dr. Stephen Leon. Our second chair is Professor Salman Kermani, a medical geneticist and pediatric endocrinologist and professor of pediatrics and medicine at the Aga Khan University. He serves as the director of the Center of Excellence for Women and Child Health, interim director of the Human Development Program, and also chairs the Division of Women and Child Health. Please join me in welcoming Professor Salman Kermani. Dr. Leon, Professor Kermani, the floor is now yours to begin Session A.
Thank you very much. It is a real pleasure to be here. It's an honor. Thank you, Dr. Zulfikar Bhutta, for inviting us to do this. We have three talks today. I'd like to invite the first panelist, Dr. Noshin Anwar up to the stage. Dr. Noshin Anwar is an internationally renowned scholar and researcher with over 30 years' experience in academia, working at critical intersections within the social sciences and health, including climate change, urbanization, gender, and thermal justice, and cutting across theory, practice, and policymaking. Noshin did her doctoral work at Columbia University, New York, postdoctoral work at Harvard University. She studies the impact of climate change on the lives and health of poor, vulnerable groups in cities using transdisciplinary methodologies. Her research spans the global south, extending from South Asia to Africa and Southeast Asia. She is affiliated with the Human Settlements Group at the International Center for Environment and Development, IIED, and is a professor of city and regional planning at a leading public sector university in Pakistan, Institute of Business Administration, where she is also the director and founder of the Karachi Urban Lab. So please give a round of applause for Dr. Noshin Anwar.
So let me just first begin by thanking Zulfikar, as always, for inviting me to be a part of this forum and what are indubitably incredibly important conversations as we go forward into this century and thinking about resilience, adaptation, the built environment, and so forth, and its relationship not only with global warming, but the deeper complexities of local climates, as I'm learning in a new project that I've just started with a climate scientist, which really kind of muddies the waters in terms of how we think about resilience and adaptation. So what I'm going to present today is a very, very quick summary of one big project that I was part of, which was funded by the United Kingdom's ESRC about 3.5, 4 years ago, and in which my colleagues and I were working across multiple cities in Africa and Asia, and Karachi being part of my ambit. And I'll just give some very quick synopses of what we call urban thermal indicators, the who's, where's, and why's of variegated thermal experiences in Karachi. This data is still being cleaned up. It's about 3 years old. And so we will be putting out a whole bunch of data for public consumption, hopefully, inshallah, in the next 9 months for everyone to, to get access to be able to think about, well, what's happening in the built environment in people's lives, what are thermal perceptions in relation to electricity, water, and those sorts of things. So, so this presentation is based on what my colleague, Dr. Adam Abdullah, who's also an urban planner at IBA, and is my colleague at KUL. We put it together, and we've been trying to sort of work on this. So this project that we were a part of was called Cool Infrastructures, Life with Heat in the Off-Grid City, and which ended in 2023, 2024. And at the outset, when this project began in 2021, which was the time of COVID, we couldn't launch ourselves into the field in the different cities that we were working in, which extended from Hyderabad in India to Karachi in Pakistan, to Jakarta, to Cameroon, Yaoundé in Cameroon, and a few others. So we hired Geopol to do a survey, and this survey was actually then supported by the Red Cross Climate Center, and it's a report that's also published that is available on the Cool Infrastructures website. And it covered 4,400 respondents across 4 cities. And in Karachi, it was a little over 1,000. And in this report, which was kind of a launch of my colleagues and I beginning to play around with this idea of what are thermal perceptions, this was the initial dive into thinking about what are people's perceptions on heat and containment. So we were trying to figure out the relationship between extreme heat and COVID-19 at that particular point in time. And the findings threw light, especially on the risks of indoor overheating, something that we often don't think about because a lot of times issues of extreme heat, which is the particular slice of the climate change dynamic that I like to study in addition to lethal heat and humidity and flooding, etc. But extreme heat often presents a very interesting dynamic, a different kind of a conundrum. And what sort of came to the forefront was that it's not so much heat waves or chronic heat outside that presents a challenge in people's lives, but under COVID-19, it was the issue of indoor overheating. And the Geopulse survey, which we put together, 7 or 8 of us, looked specifically at low-income settlements across these different cities. And if you want to look at the report, you want to access the PDF version, it's available on the Cool Infrastructure's website, as I mentioned, and it includes the survey also that we compiled. And so I'll talk very briefly about the initial results of the survey, and then I'll dive into the big survey that my colleagues and I did at KUL, which was also part of the Cool Infrastructures project. And it was a household and an occupational survey where we once again thinking about thermal perceptions and those sorts of indicators in relation to things like water, the built environment, different kinds of houses, materials, those sorts of things. And I'll talk a little bit about the big survey design and then focus on key takeaways, policy, and proposals. So the Red Cross report, which is what I call it because the Red Cross Climate Center is the one who urged us at the very outset to produce it. The key insights from the Geopulse survey, which covered 4,400 residents across these cities, was that 63% of respondents, this is just for Karachi, where we covered a population of, where the Geopulse survey covered a population of 1,172 residents, 63% of respondents at that time reported being more affected by heat. And the Geopulse survey was conducted in June and then it was conducted again in July. And that was a point in time where there was no heat wave ongoing. And we looked essentially at the differentiated strategies. The Geopulse survey asked the respondents to talk about heat mitigation. And there were specific kinds of questions and specific kinds of variables that were built into the survey to prompt people's responses. So some of the things that came out of this was that the differentiated strategies of heat mitigation were very much contingent upon materials. And for those of you who are architects, will probably say, well, yeah, that's pretty much common sense. But sometimes it's important to actually dive into the how and the where of this and kind of pin down what are people actually saying about their living conditions and the materials through which they mediate their everyday livelihoods and their lived experience. So reinforced cement concrete homes, we found that they rely more on electricity, where fans and generators especially become a very important part of heat risk mitigation. In mud houses, we found there was greater usage of water, used for showering and moistening clothes. And then for those homes that were built with galvanized iron roofs, we found that people responded that they went outdoors more often and hanging out near tea stalls or in streets or parks or going outdoors. And based upon this particular Geopulse survey then, what we decided was that for future surveys, we were going to start looking at the compounding effects to analyze the intersections of different kinds of indicators, and of course, taking issues of intersectionality into consideration as well, which is always very important. And then looking at people's locational strategies, considering green spaces, commuting patterns, and housing materialities. And then also very much then putting at the forefront, not so much the issue of adaptation and resilience, which I feel sometimes become buzzwords unless we think about vulnerability to hazards and risks, which I think for me is the first point of interaction, looking at pre-existing vulnerabilities that are not necessarily anomalies, but reflect the broader urban experience for the majority, the compounding impacts of chronic and discrete thermal events that exacerbate existing vulnerabilities, and then of course thinking in terms of intersectionality, gendered experiences, differentiated thermal experiences that are especially marked across genders, which we very much continue to find in our ongoing work. And then in terms of thinking of the way forward to examine low-income informal settlements at a higher resolution using disaggregated household data, which we then decided to do when we launched our big survey at the Karachi Urban Lab, which included over 7,000 household responses on thermal perception and something like 3,000 responses across different outdoor occupations. And in this, and this is the big survey that we're actually now cleaning up now. We have a lot of data coming out of this. It's taken us 3 years because we got waylaid by other projects, and this is the data that we hope to make publicly available for others who may find it quite useful. So in this, we were looking at housing materials and densities, factors like building materials and population density that significantly influence indoor temperatures, infrastructures, access to and quality of infrastructure that impact residents' ability to cope with heat, And then, of course, cooling practices, diverse strategies employed by households to mitigate heat within their homes. And this would also be very much contingent not only on energy, but also water. Water is something that we often don't think about when it comes to thinking about cooling strategies. So what we found was, especially in the household survey, that when we asked, how do you feel inside your home, 47% of respondents reported that they felt hot, and 11% said they felt warm, indicating significant thermal discomfort. So this household survey was carried out in 2022. It was June and then July, and then it was repeated in the month of October, because we know that in Karachi, summers are becoming longer and extreme events kind of are recurrent, and the compounding impacts of that have become quite complex. So I'm going to just, briefly just come down to this, because, oops, what happened over here? We lost that. I was trying to actually, get to that smaller stuff that I had written at the bottom, but I'm sorry, I lost it because it's not showing up on the screen. So never mind. Is that going to plug in over there? Okay, thank you so much. Sorry about that. Thank you. So we aimed for 15,000 household surveys. We completed a little over 7,000. We aimed for approximately 5,000 occupational surveys. We completed around 3,500, and the occupational surveys were conducted across about 45 different kinds of occupations, and these were largely all outdoors. And we covered for both surveys 57 different sites in Karachi. And this is just to give you a very quick idea of what these sites look like, where they were, the locational aspects. And then also the different kinds of plot sizes. So we took into consideration, when it came to understanding the relationship between thermal perceptions and risk mitigation strategies, and what people were actually saying about heat, that the issue of plot sizes and what were the actual sizes of the homes, we took plot sizes into consideration. So anywhere from 80 square yards to 60 square yards to 120 square yards. We know that in Karachi, land tenure systems are quite complex, and plot sizes are subject to change depending upon political economy considerations at the local level. So basic demographics, these are the age ranges. In gender-wise, it was predominantly a male population. The duration of stay for respondents was typically 21 plus years. So these are individuals who have lived in Karachi for well over 2 decades. Family structure was largely nuclear family, and 72% were employed. Thermal perception, simple question, how do you feel inside your home? And 47% reported at the time that they felt hot. When we looked at housing details in relation to thermal perceptions, different types of housing, we found, interestingly, this is all open to, to debate. This is just data coming out of that survey. And as I said, we're still cleaning it up, still trying to figure out what all of this means. 74% who reported feeling warm or hot, especially when there was a shared floor portion in a low-income or informal settlement. And another very interesting finding was in terms of floor and floor sizes, that for ground +2, ground +3 and higher, 71% reported experiencing more extreme heat or feeling more hot. And what was particularly important, and this was actually in relation to responses from female respondents in relation to the placement of the kitchen. And there was consistency across the sample that when women talked especially about their homes in relation to where the kitchen was placed, there was generally a deeper or a greater experience of greater discomfort in terms of exposure to feeling hot or feeling extreme heat. And then also in terms of materials, for instance, wall materials, mud brick homes, people who lived in mud brick homes reported feeling more warm or hot. Roof materials also made a difference. Those whose roof materials were built with bamboo or wood reported feeling more warm or hot. Floor materials, marble, and especially a kacha floor had a particularly interesting impact on people's thermal perceptions. This is a really bad slide. I've squeezed it in at the last minute, but I thought it was a very important one because Adam and I are trying to figure out, as far as water consumption is concerned, that what were households or people's per capita water consumptions across these different locations and within these different households. So generally, household water cost and then drinking water cost. And we have some numbers, but unfortunately, we haven't had a chance to scale them down yet, but this is some of the data that we hope will be accessible to everyone down the road. And the reason why household water cost per capita and drinking water cost per capita becomes very important is that when we look at these different locations or these different sites, we see a tremendous amount of variability in terms of per capita water cost within these different households. And what we believe is that this very much has an impact on people's heat risk mitigation strategies then. And the location of these households also is then very much dependent upon the kind of infrastructure, water infrastructure system that they are embedded in. And of course, Karachi has a very long story and very long history of public water access versus water that comes from tankers or communal water pipes, etc. So it's a highly variegated infrastructure. It's not a consistent infrastructure across the board in these different sites. So per capita water consumption varies across this household. That is a definitive in terms of our finding. And that in turn affects people's perceptions of how water should be handled, consumed, and used for heat risk mitigation strategies when it comes to cooling initiatives. And what that actually looks like is something that we will be figuring out soon. So long-term thermal perceptions. So when this survey was being conducted, a key question that we asked was, compared to the same month last year, May, June 2021, has heat affected you more? And we found that 95% reported that they felt more heat or were similarly affected by heat. Women there was a slight differentiation, women reporting a slightly higher in terms of thermal perception. But what was even more interesting was that 50% of the household respondents reported having received no kinds of heat wave alerts ever. Now, we know Karachi has a heat wave management plan. It does not have community-based heat adaptation plans, which is something that the Global South is getting into in a very big way now, kind of scaling up knowledge from the ground up. And this is happening in cities in Africa. It is happening in cities in India, Maharashtra especially. The state of Maharashtra is doing absolutely amazing things on community adaptation initiatives when it comes to heat, and they've moved beyond, it's just incredible what they're doing there. So that despite the fact that there are heat wave alerts from the Pakistan Meteorological Department, and they kind of cascade down to the provincial, and they're kind of supposed to get to the district commissioner level, we found that, so we're looking at over 7,000 households, right? So 50% nevertheless reported receiving no kinds of heat wave alerts ever. 15% reported themselves or a family member being affected by heat, and 22% of that reported that that was fatal. So moving on very quickly to the urban data on heat when it came to the commercial surveys, we were looking at different types of occupations and routines, workplace materiality, number of work days, exertion levels, shade and hydration practices, and in terms also of how physically demanding the work was outside. By and large, people reported highly physically demanding. We were looking at types of workplaces. Largely, these were completely outdoors, gender-wise, predominantly male populations. Duration of stay, again, 21 plus years. More than 60% reported that they had lived or worked in Karachi for more than 2 decades. And one of the things that we were trying to find out was, especially in comparison to the year before, so 2022 is when the survey was being conducted, so what were people's perceptions in 2021? Had people learned to adapt themselves? What were the negative impacts? And all of this is somewhat still unclear. So we were thinking in terms of asking people about number of work days, when they were out there, were their thermal perceptions of heat impacting their work days? Did they take breaks during work? And 49% reported that yes, they did take breaks during their work. And we're wondering if this is some kind of an adaptation strategy that people deploy, thinking adaptation, coping, sometimes that line is very blurred. And then one of the very, very big challenges that came to the forefront was basically access to water. For the vast majority of those working outdoors, access to water is a huge challenge. And this then does make work especially demanding. It has a huge bearing on the strain that people feel in terms of their bodies, and in turn how that impacts thermal perceptions. So I'll skip this one. So long-term thermal perceptions, again, what were people's thermal perceptions in relation to the year before? 84% felt more or similarly that they were affected by heat compared to May-June of June 2021. And 53% reported having received no kinds of heat wave alerts ever. So key takeaways in terms of housing details, residential density and thermal discomfort appears to have a correlation. Floor height, thermal discomfort appears to have a correlation. The greater the floor height, the more. But I'm not entirely convinced about this. This is a particular aspect of the data that Adam and I are struggling to figure out. And there is a very strong correlation between the availability of ventilation and the perception that this lowers or makes easier, dealing with issues of extreme heat. RCC roofs, slightly cooler than T-girder with cement tiles. Iron and tin sheet roofs are mostly thermally inadequate. During high heat seasons, marble flooring feels hotter than cemented or tiled floors. And for the work routine or commercial surveys, the greater the number of work days and more solar exposure, heat exposure, the greater the thermal discomfort. The fewer the breaks or no breaks, there appears to be less thermal discomfort, but we're not entirely sure why the data is showing this. The big negative impact is the less access to water. If water is not accessible, the higher the thermal discomfort, physical exertion, greater thermal discomfort. What is unclear in our data is the indoor versus the outdoor, right? Indoor heat exposure, outdoor heat exposure, or work near a heat source. What is the relationship with thermal discomfort? So very quickly, key takeaways and policy proposals. So as we go forward in terms of synthesizing the findings from the household and commercial surveys to inform policy, there are three very important things that we're keeping in mind. The housing and the built environment, which addresses the issue of residential density, floor height, ventilation, material choices. Secondly, heat information dissemination, implementing the importance of implementing a highly accessible early warning system and a multi-platform outreach for heat alerts. But I would still say that this is very technocratic, it's very top-down, and actually what you really need to be looking at is community-based heat adaptation surveys. How do you actually scale up knowledge from below without it necessarily kind of being a sort of a colonial type of intervention where you're just kind of exploiting people's knowledge systems. People do adapt, people are coping vis-a-vis extreme heat, but the community adaptation-based solution aspect is incredibly important to think about, and we're really not having conversations about this in cities across Pakistan, whereas in other parts of the world, in other urban centers across the global south, this is really, really moving very, very fast. And then finally, integration with the medical domain, considering the biological, the physiological, the medical impacts, and the interplay that all of these sort of different kinds of dynamics have between thermal perceptions and adaptation strategies. And very quickly, I would just like to sort of end on one final note. I've just moved on to another project, which is based in Jacobabad, where I'm actually working with a climate scientist. And what has really kind of thrown my whole understanding of adaptation, resilience, and climate change into a bit of a conundrum is how we think about global warming in relation to local climate. And one of the things that we are finding in Jacobabad, for instance, is in very, very different extreme heat environments compared to Karachi, that agricultural systems, essentially, so in Jacobabad, for instance, you have rice agriculture. The waterlogging essentially impacts humidity levels extensively. And in climate science, there's an interesting dynamic that happens that when there is more water in the air, the temperature gets lowered, right? Temperature goes down, but the humidity factor rises. So the humid aspect, the lethal heat and humidity aspect becomes a much bigger challenge. So local climates, local ecosystems, and the built environment kind of throw a bit of a wrench into how we think about, we should be thinking about resilience and adaptation. And then we move to cities like Larkana, where we're going to be launching another project. That's like dry heat, totally different kind of dynamic. So when we're thinking of solutions and adaptations, there is absolutely nothing homogeneous about this broader urban terrain. I'm an urban planner. I focus on cities. I don't focus on the rural, which does not denude the importance of the rural. But I think thinking about the local climate, especially in relation to South Asia, and how cities are configured in this incredibly different local climate dynamic is a very, very important part, and we need more research on that, and we do not have enough research on that. So I'll end right there. Thank you very much.
Thank you very much. That was fantastic. We have time for one very quick question, or two very quick questions, one slightly longer question before we move on to our second talk. Anybody? We cannot. Yes, Dr. Zulfikar. So we can get to these two questions, I think.
Well, maybe I can just shout. Roisin, that was brilliant, as always. So in terms of the measurement of heat effects, I wonder if you, as part of your study, if you looked at measuring petrol theft, which take into account both dry heat as well as humidity. That may, as a metric, be something that allows you to look at this differentiation.
So, yeah, thank you, Zulfikar. So in this new project that my colleagues and I have just launched in Jacobabad, so we're using heat sensors indoors, and then we're hopefully going to be installing what are specially made devices for measuring WBGT and all of that. But we run into a bit of a problem. That's the ISI. So we have been working for the last 9 months to military agencies, Pakistan, 27th Amendment, a whole different dynamic when it comes to field work. So Jacobabad has currently suddenly turned into a very hostile environment for us. So my colleagues Tom Matthews, Hebe and I, we were venturing forward towards Jacobabad last weekend to start with our Pakistan Meteorological Department associates, 3 of them who came from the PMD in Islamabad. We entered Jacobabad with our instruments, which we were not exactly flashing, and there was the ISI, and they said, go back home, you're not doing anything. So we ended up, so we're partially going to move to Larkana for the heat sensors, because we're not going to be allowed to install heat sensors inside people's homes. What we're hoping is on a different plan for the PMD to step up and help us install those outdoor instruments, which will then enable us to examine precisely the importance of the point that you have made over here. Thank you.
Okay.
Well, I haven't given up. I have not given up.
If you could use a very quick question, and then we would move on.
Thank you, Nosheen. Always a pleasure listening to you. I had the opportunity to work with Ahmedabad Municipal Corporation in India to develop the first heat wave and then replicate that in Karachi. And a fundamental difference between the two, if I have to, because of the time constraints, say, there we linked it with health. And in Pakistan's case, with Karachi's case, we linked with institutional coordination. That was a weak point here. But there was an important finding in Karachi that is not reflected in the heat management plan for Karachi. This was the building designs. Because of density, there's no ventilation. The household surveys that we did, there's only one entrance, sometimes with a side window, and then there is no circulation. And therefore, the people who died in Karachi were mostly elder men and women who were at home. Younger people were out there in work. Their exposure, even though was more direct and more intense, but the rate was higher in covered areas. And there was no solution to this kind of thing. But the reason I'm mentioning this, the city continues to grow with the same kind of intensity and same kind of built environment. So I was wondering, in this survey, is there a provision for the built environment?
Ali, that's such an important point on the ventilation aspect, because in the broader story of how we think about cooling infrastructures, we think about water, we think about energy, but ventilation aspect is hardly ever brought to the forefront. So on that question, that is something that Adam and I are grappling with, as we're still in the midst of cleaning up this data, because we've been sort of held down by various other projects as well. But I mean, in terms of policy impact, yes, that is something. But It's a political economy question at the end of the day. I really think so. That something as mundane as ventilation is something that is so deeply political because it's very much tied to the dynamics of Karachi's and other cities across Pakistan, land tenure systems, and what is the conflagration of bylaws concerning the built environment, its protection, its regulation. You know that. There are people sitting in this room today, architects and other urban planners who are very well aware of that. So I think that we also need to simultaneously get the political economy tweaked, where building regulations and bylaws and these sorts of things and the very rampant and what is oftentimes both a sociological motivation but also a profit-making greed factor that is attached to it. So it's the ground plus 2, plus 3, plus 4, both commercialization as well as residential density, the encroachment factor without necessarily demonizing the poor because, you know, that's also very dangerous. We end up kind of, that's a slippery slope. So I think really that is such an important but a political economy question which needs to be part of the much bigger you know, adaptation resilience strategy. If we can make our building bylaws and regulations resilient in terms of their implementation, so it's institutional resiliency. So the resilience issue isn't just about the body, it also extends very much to institutional capacity building. Then I think we are much better prepared for what is to come or what is already happening. And ventilation is such a tiny but such an incredibly important part of that story.
Great. Thank you so much, Dr. Anwar, for that illuminating talk. And I'm sure there will be more questions, and we can certainly have that at the end at the panel discussion. So now it's my pleasure to invite Dr. Mehreen Mujtaba to the podium. Dr. Mujtaba is an associate professor at the Health Services Academy and served as the director for climate change, health and nutrition at the Ministry of National Health Services, Regulations and Coordination. She oversees national nutrition policies and programs addressing the impacts of climate change on nutrition in Pakistan. Dr. Mujtaba's work focuses on developing and implementing strategies to improve nutritional outcomes and public health resilience. So over to you, Dr. Mujtaba.
It's off. A very good morning to you all. Ladies and gentlemen, we are here today to discuss a critical but a very important and often overlooked issue, and that is the health sector's role in the climate crisis. While our primary mission is to heal the sick, some of the operations that we do through our buildings and through the mechanisms that the healthcare works is also contributing to the very problem that is making people sicker. Now, today we will outline a proactive path forward for Pakistan, not just to reduce our carbon footprint, but to build a more resilient and a more effective health system for the future. Sorry, there seems to be something wrong with this. So my name is Dr. Mehreen Mujtaba, and I will be walking you through the undeniable link. Can you just turn this on here? The previous slide, please. The previous slide. Sure. Okay, so my name is Dr. Mehreen Mujtaba, and I will be walking you. Okay, sure. I will be walking you through the undeniable link between climate and health in Pakistan. Now, I will present some groundbreaking data on the health system's emissions and introduce a strategic program which we developed with the support from the Asian Development Bank. And this work aims to position Pakistan as a leader in climate-smart healthcare. Next slide, please. Now, why is climate-informed response a key? This isn't a future threat for us. This is our present reality. Pakistan is on the front lines of the climate crisis. The question is not if we should act, but how we should be acting right now. A climate-informed health system is no longer an option for us, but it is a fundamental issue for our national security and for building our national resilience. Now, by decarbonizing our health sector, we are not just protecting the environment, but we are also future-proofing our ability to deliver care whenever our populations need it the most. Now, look at some of these impacts that I had a chance to put together. From the melting glaciers in the north that feed our rivers, to the devastating floods that submerge our heartlands, to the scorching heat waves that we were just talking about in most of the urban cities in our country, and which not only strain our power grids, but also inundate our hospital with the patient influx. This is the battlefield where our health systems must operate. And unfortunately, this is the time when our health system fails to operate. Now, can we go to the next slide, please? Now, when we look at the demand side and supply side and provision of healthcare, what we see is that climate change is a threat multiplier. Now, it is dramatically increasing the demand for the services. We are seeing more malnourished children, a surge in dengue and cholera cases. We are looking at a generation of children whose lungs are damaged by air pollution in most of the urban cities across the country. And we are also seeing a rising tide of heat-related illnesses, mortalities, as well as morbidities. Our hospitals are already feeling this strain. Simultaneously, climate change is crippling our ability to provide care. Now, imagine a hospital which is flooded. There is no clean water supply for the patients, and the roads are washed off. So what do? This is a dual challenge that we face in our healthcare system. We have more patients, but we have fewer functional facilities. Now, decarbonization goes hand in hand with building our infrastructure that can withstand these shocks. Next slide, please. Now, we recognize our health system is currently facing certain challenges. But let me be very clear. These are not excuses for inaction. They are the very reasons why we must integrate climate resilience and efficiency in every reform and in every new investment that we make. I think, and I think you will all agree with me, that it is much cheaper and smarter to build it right the first time than to spend more money and retrofit the hospitals later on. Can we go to the next slide, please? So what are we doing about this right now? We are moving from talk to action. In partnership with the Asian Development Bank, we are developing a concrete, financeable decarbonization program for the healthcare sector of the country. This is not a theoretical exercise. It is a roadmap for transformation, aligning global climate goals with local health priorities. Next slide, please. Now let's have a look at some of the data that our research, the scoping study elicited. Now, for the first time, we have a clear baseline for the health sector emissions in Pakistan. Our health system contributes about 5.5 million tons of carbon dioxide. Now, this is approximately 1.1% of Pakistan's entire carbon footprint. This is our accountability metric that you are looking at right now. The two biggest levers for change are clearly set out over there. One is our buildings, which contribute to about 34% of the emission, and the next is our supply chains, particularly the pharmaceutical industry, which is responsible for 47% of these emissions. Now, this data tells us exactly where to focus our efforts for maximum impacts. Next slide, please. Now, I'm going to quickly take you through emission breakdown by the provider type. Now, this breakdown is quite revealing. This is showing us that decarbonization is not just a hospital problem. We mostly think it's our hospitals which are contributing to the GHG emissions. But when we look at this, pharmaceutical industry is a major contributor at 43%. This means our strategies have to be system-wide. It has to engage every link in the healthcare chain, from very large hospitals to the outpatient clinics, as well as to the pharmaceutical clinic, to pharmacy supply chain managers. So we have to look at this and kind of make our policies based on whatever is being shown here. Can we go to the next slide, please? Now, looking at the emissions by region, what was very clear is that the geographical spread of the data set that we just looked at aligns with the population and the economic activity across the country. So obviously, Punjab, Sindh, KP account for 94% of these emissions. Now, this isn't just about blaming the provinces, but this is more about prioritization by the provincial governments. It will give our provincial health departments a clear mandate and a clear opportunity to lead the change and devise policies based on sector-wide emissions from their healthcare sector and how to kind of make and align whatever their future financial priorities are in the health sector with the breakdown that is being shown here. Can we go to the next slide, please? Okay, now data is only the starting point. Now we have to move to implementation. Our next steps are very deliberate and they're very clear and they're very actionable. Now we have a set science-based targets. We will commit to credible, ambitious reduction goals. Secondly, we have to create clear investment plans. We have to translate our ambitions into budgeted projects from solar power to energy efficiency, as well as to green procurements, which is a very important step for greening our healthcare sector. We have to integrate into performance tracking. We need to make decarbonization a core KPI tied to financing and leadership accountability. And lastly, but most importantly, we have to build the capacity. We have to equip the teams at every level with the skills to lead this transition. Now, this is just the beginning, what you're looking at. The foundations that we lay today can be scaled across the provincial health departments and the provincial health systems. We have the data, we have the strategy, and we have been building the partnerships. Now, the work will not only reduce emissions, but this will also lower operational costs for the provincial departments as well as for the hospitals in the private sector. It will improve the air quality, and by doing all this, it will create a more reliable health system for all Pakistanis. Last slide, please. Now, to conclude, decarbonizing Pakistan's healthcare system is a triple win. It's a win for the public health, it's a win for financial sustainability, and it's a win for the planetary health. So this is our moment to lead, ladies and gentlemen, and we have the prescription for a healthier future. So now let's work together and fill it. Thank you so much.
Thank you so much, Dr. Mushtaba. So I think we do have time for a few more questions, and then we can have more questions at the end. So please take a seat, and we'll ask the audience if they have any questions. I think Dr. Bhutta has.
I'm taking advantage of sitting up front, actually, so I don't want to hog the conversation. So, Marine, let me challenge one aspect, okay? So a lot of the stuff that I've seen on Pakistan health system resilience development has largely been focused on emissions and on carbon neutrality. And without taking this away from the importance of this topic, where is the equivalent in terms of making health facilities client-friendly? All the other adaptation mechanisms that you need to put into the infrastructure to ensure that people have adequate ventilation, safe systems to breathe, and also particularly the kind of adaptation that would make it possible to access services in summers at a time when it is suitable for women and children. Why do these facilities have to work from 9 to 2, exposing people to the peak heat hours? Why can't we have innovations such as, for example, ordinary laborers do, is to start the day a little earlier, finish a little earlier before it's extremely hot, or introduce innovations like group antenatal care. A lot of things that we did in COVID, just to finish my point, was all around reinventing things so that we could make it friendly for clients. For example, dispensing stuff in antenatal care, the commodities, in bulk rather than having people come back every month. So I just wonder if there has been a discussion on this within the Ministry of Health, because you are probably more aware of that than anybody else.
Okay, so thank you for the comments. So more than a question, I think it's more of a comment, and we all understand that for policymakers to make their decisions, you have to kind of have a financial model and talk in numbers for them to understand and to buy in a certain project. So when we did this scoping study with ADP, one of the reasons was that instead of just telling our policymakers to retrofit or green the hospitals, we had to kind of give them a baseline for the sort of GHG emissions that are coming from the hospitals and to start thinking along those lines, because this was a first that was done in Pakistan. Pakistan was one of the denominator countries in the global south, along with Fiji and Indonesia. So there were just 3 countries where this scoping study was done, and one of the reasons was to understand the healthcare, because most of the studies that have come out and most of the data that has come out is from the West. So we wanted to first have a baseline scoping study to build our next steps and to build our roadmap for the future, as well as to have more actionable plans in future based on these. As far as the questions about, and the comments, sorry, about why can we not change how we cater to the needs of our patients is more of a policy dialogue. It's not a debate that is happening within the ministry. During COVID, we saw that just because of a certain tweaks in how you should be going out, what times you should be seeking any sort of, interventions or whatever time you could go out, that was kind of a policy narrative which was fed to the masses, and we all lived with that. So I think your comment is well taken. That is something how it should be done. During the peak hours, most of the workers should be asked to stay, as your research also elicited, that outdoor workers are, getting the brunt of the heat wave. So yes, that's something that should be done, but unfortunately is not done. So I can't comment much about how a policy is made.
Great. Thank you so much. I think we have one last question here, and then we'll move to the next topic.
Thank you. Thank you for an excellent presentation. I thought it was very interesting to see the impact of the pharmaceutical industry on carbon emissions. And I wondered if there was a program of work looking at preventative measures as opposed to decarbonizing the pharmaceutical industry itself. So by that I mean there was a recent study showing a massive reduction in cancer remission with a structured exercise program, for example. And so bringing healthy lifestyles into prescribing as a way to reduce the carbon costs, because you then reduce the pharmaceutical demand. Thank you.
Okay, so when we did our scoping study, what we saw was the scope 3 emissions, which are from the supply chain, are the highest in Pakistan, as you just saw from the data sets. And this did not actually, when we were doing the study, did not take into account the life cycle span of the supply chain. Okay, not the movement of the medicines and all that. This is primarily based on whatever is sold out from the clinics close to the hospitals. So as far as strategies for a healthier lifestyle and all that, that is something which is under discussion. There are a lot of talks around that, not only just to reduce the decarbonization aspect, but apart from that, for in terms of the non-communicable disease burden as well, to reduce that. This was a study done just to have our policymakers get an understanding of what the healthcare system was doing. So on the one hand, it is supposed to provide care to the patients, but then at the same time, it is a contributor to the very same thing that is making people sick, which is the impacts of climate change on human health. So this was just for that particular reason that we did this, and now we are developing a national action plan of how to tackle the emissions from the pharmaceutical supply chain.
Thank you very much. I think let's give Dr. Mujtaba a round of applause. Our final talk for this session, the speaker wasn't able to come in person, but we have a video message. This is Professor Daniel Barber, Professor and Chair of Architectural History and Theory at the Technical University of Eindhoven, Netherlands. His research examines the intersection of architecture, climate, and energy, focusing on how design has responded to environmental challenges across the 20th century. He's the author of Modern Architecture and Climate, Design Before Air Conditioning, published by Princeton University Press in 2020, and A House in the Sun, Modern Architecture and Solar Energy in the Cold War, published by Oxford University Press in 2016. Dr. Barber's work continues to influence global conversations on climate-responsive design, sustainable building practices, and the role of architecture in shaping equitable, low-carbon futures. And if we could get the video up, we can begin.
Hello, everyone, and thank you for the opportunity to present some of my research. If you'll forgive me, I'm just going to, sorry, my name is Daniel Barber. I am a professor of architecture at the Technical University of Eindhoven in the Netherlands. And I have been spending a lot of time thinking through the means by which we are conditioning the built environment, the cooled and heated spaces, what I like to think of as the thermal interior. What I want to present to you, and now I'll start to get to some slides. What I want to present to you has to do with some questions around the way that these spaces have accumulated in the global north, the cooled spaces and heated spaces of the thermal interior. And I'm wanting to play this out to you in the context of a sort of a call to architects and policymakers in regions where carbon has over-conditioned our interiors, has sort of set up our interiors to be requiring mechanical conditioning to disrupt that process, to disrupt machines like this, to sort of reimagine the ways that we're building, to reimagine the ways that we're experiencing these interiors, to reimagine the ways that we sort of coordinate our relationship to the future vis-a-vis the comfort and the carbon that kind of goes through our built interior. So in many ways, I'm presenting a sort of foil, I think, to some of the discussions that you're having there, as sort of means to understand sort of what we're up against as these mechanical systems continue to proliferate. On the one hand, often for reasons of luxury or excess in the over-carbonized economies of the global north, but often for reasons of need and well-being and even survival in, of course, many overheated spaces, overheated cities around the world. So wanting to put this dynamic on the table, talking through some of the ways I've been trying to encourage discussion around the thermal interior, the sealed space, and the cooling it requires. I've paused on this slide a moment just to kind of remind us of the basic principle insofar as what we're talking about is that when a space is air-conditioned, and that's largely what I'm focused on, the intense energy output that emerges from air conditioning spaces that often don't quite need them on some registers, right? But the use of air conditioning as a means, as we see here, that does not exactly cool the air or sort of magically change the air in the interior, but rather moves the heat to the outside, right? And producing waste heat alongside the carbon emissions. Well, I think I'll skip that slide for today. So, all of these graphs and charts that perhaps many of you are familiar with from other contexts that are demonstrating the seemingly inexorable rise of air conditioning. And it helps us to understand the need to be very targeted about how we cool our spaces, the need to consider those situations where air conditioning is more a question of survival than a question of luxury, to maintain well-being and public health in overheated conditions. But the challenge we face, of course, is that air conditioning, and here I'm showing that it's now been overtaken by data centers, so that's maybe another discussion. But that the accumulated emissions coming from the air conditioning, the mechanical air conditioning of our spaces, of course, just reasserts this cycle, right? Reasserts the cycle by which we then need to cool more. The more we cool, the more carbon emissions, the more unstable the climate, the more air conditioning is needed, right? So I'm not here to suggest that in overheated cities, in a lot of vulnerable places, as we'll see in a moment, that air conditioning is not needed, perhaps even a need to expand it, as some of those charts were just indicating. But rather to suggest that in those places where it's not needed, that I'm trying to sort of perform for you this kind of agitation that I play out with architects in parts of Europe and North America, Australia, other parts of the world, parts of Asia where I'm invited to talk, to think about how they can, how the architecture discussion and discourse and profession, and certainly in the schools, can start to shift its perspective on the necessity of air conditioning in spaces that are already sort of adequately comfortable, if you will. So it helps us to put in context this quote from Richard Neutra in 1947, saying that there has, of course, always been comfort in the world, reckless comfort, we could say, comfort based on someone else's continuous labor, right? So again, just a clear indication of the kind of inequity, the imbalance of the system that the air conditioner is perpetuating. And we're quite aware of these inequities, not only geographically, but also temporally, which is to say, the kind of future people whose lives are being compromised by the excessive use of air conditioning in the global north. This is just a slide showing some of Neutra's passive interventions in that period, right? And recalling some other work that we'll glance at a bit later, to recognize that there's a lot of research and ideas that have played out, again, back to what I assume is much of what's going on in your discussion, how to passively manage overheating. This is one of my favorite examples, Oscar Niemeyer's Over du Berceau from 1936, which is a home for recent mothers and their children, right? So a sort of space for rest and care, whereas you can see the shading system can vary across the different elements of the facade in order to manage different light and heat situations over the day. And then, of course, other projects that kind of indicate this other side, such as the Cool Infrastructures project that Nausheen Anwar has been involved in as one of many that have started to proliferate these questions of how to heat and cool differently. So I want to just talk through quickly two projects that have helped me to think this through, again, help to sort of surface these issues in a discussion, in the discussions that I'm involved in. First is this project that was commissioned by Carla Ratti for the 19th Venice Architecture Biennale, just closed on Sunday, but open for about 6 months, in which we were asked to sort of intervene at the beginning of the exhibition. If this is where our project was, and then here's the sort of long hall of the exhibition space called the Arsenale. Here's a sort of view of that a bit more, experientially. We were asked to intervene. This is sort of what followed after our project. Intervene in the space as a means to help think about, again, kind of surface or bring to life this question of comfort and conditioning. And to do it, we called the project Terms and Conditions, to do it in such a way that one felt they had to sort of accept this challenge, right? Kind of check this box and say, yes, I agree to this system as a sort of means of preparing oneself to enter into the rest of the exhibition, which I just showed very briefly, which was largely a series of technical solutions, right, to potential climate problems. So you walk into this space and it's quite hot and uncomfortable. It's a little smelly. These pools have been designed by Michelangelo Pistoletto, as well as the mirror and the arc of light in the back, designed by his team. And we've placed a number of air conditioners at different heights around the space. You can hear the hum. And you might anticipate in seeing this or in walking in that there's a kind of a sense of comfort, a sense of well-being, a sense of coolth, right? But in fact, we've set it up such that this is the waste heat side of the air conditioner, so you're actually experiencing, relatively extreme discomfort. Again, sort of forcing this upon those flying in to see the Venice Biennale, to quite literally see themselves, see the kind of costs that play out relative to the building industry and the kind of path dependencies that have formed and reformed the infrastructure, again, in the overcarbonized economies in particular over the past decades. And, there's a quite literal moment of reflection, as we see here, a sort of self-awareness of, again, those of us, myself, a middle-aged white man living in right in the midst of one of the overcarbonized economies, right, in the EU, aware of this kind of dynamic of being a part of the problem, right? And so again, really trying to surface that through this project. And then as you walk through the back, outside of this discomfort, you see, as we've just seen, the cool side of the split system that is now sort of bringing a wave of air, a wave of cold air onto your body as a means to recognize again that the way that we had constructed this is that you've walked through what was often in effect the outside, right? What is often where the waste heat goes, the vulnerable space, the compromised space, right? And sort of trying to bring that into the heart of the exhibition system. So that was one project. I'm going to shift to another was a institutional sort of investigation at the New Institute, an institution in Rotterdam that was hosting the International Architecture Biennale Rotterdam in 2023. Again, a biannual, an exhibition space. And we had become aware as we were preparing some material for the discussion with them that they were in the process of changing their air conditioning system, right? They were getting a more efficient system. They were moving some of the components to the roof. They were sort of readjusting the mechanics of the process. And we see here the context that we're talking about. This is the exhibition space, the brick building, and in the back, a sort of short tower, almost, a short kind of glass skyscraper. Insofar as it's getting a lot of sunlight, right? It's quite exposed. And then here in the back, the archive, the National Archive of the Netherlands, and you can see in a quick sketch in exhibition space, the little tower and the archive. So we proposed to, learning that they were getting a new air conditioning system, we decided to make a film that was documenting, sort of discussing the transition with a number of the workers and users, I should say, those who occupied the building and used it on a daily basis, and in this case, those who sort of engaged with its operations and tried to understand it. Talking, for example, in this discussion about how her office is there in the basement of the exhibition hall, where it's quite cool in the summer, so often the executive team would take their breaks there and cool off from their hot tower, and that's often when a lot of discussions happened, right? When a lot of sort of work got done. We also talked at great length. Let me see if I can get to the next slide. With the archivist, one of the archivists, who helped us understand the kind of delicate dynamics of keeping these materials safe, but also recognizing that the set points of temperature and humidity that were being used to manage these materials had some flexibility, right? There's room to reconsider the kind of demand of carbon, even in a place like this, so to speak. And we talked to many others, and we helped to think about, on the one hand, different intermediate strategies, sort of adaptive opportunities by which one could open windows or allow for different sorts of induced ventilation strategies to emerge quite easily. But mostly we talked about how life transformed alongside the transformation of the space itself, and helped us to think about a premise that I want to end with, there we go, which we've thought of as thermal practices. And I'm just quickly showing you a series of essays that I've commissioned over the past couple of years on the eFlux architecture online platform, which has brought together different kind of experiments and ways of thinking about changing the way that we, and by we I mean, again, quite directly, those of us in the overcarbonized economies, too reliant upon a consistent, purportedly universal, very energy intensive mechanical conditioning system, how we can start to think about different ways of cooling and heating, right? Of kind of reimagining our relationship to these mechanical systems in very dramatic ways at times, right? And so reducing our energy throughput, but also thinking about the kinds of practices, the kind of modes of inhabitation, right, that are appropriate to this. Here we see the images of, in the north of Poland, these interventions with the hanging of textiles and the sort of manipulation of space through these different membranes that help to contain some of the cold air or sort of, isolate the heat and in the interior. As a means, again, to sort of adopt a different relationship to sort of a different practice, a different set of habits, a different sort of cultivation of a way of being in the world. And a set of practices as well relative to design and to policy and to considering how the transformations to architecture that I'm discussing are not exclusively a question of the way that we inhabit, but also, again, the way we design, the way that we regulate, trying to understand this question of thermal practices across use, design, and policy, right, as a means to really think differently about the built world. So let's see if I can, not sure. Oh, okay, maybe I'm still going. Well, thank you for your time, appreciate it.
Okay, I'd like to invite Dr. Noshin Anwar and Dr. Mehreen Mujtaba back onto the stage for a panel discussion. And I think given we started 15 minutes late, we have a reasonable time for conversation. And if I could, while you're doing it, if I could take advantage of my position as chair, I'd like to ask you, both of you, one of the things that it's always struck me about Karachi in particular is the rapid urbanization that's happened here. And you talked about Larkana, you talked about some of the other areas. To what extent might some of the issues that you're talking about be ameliorated or mitigated if we could, not we, if Pakistan could somehow attract people to urbanize in other places instead of this incredible concentration here in the big cities, Karachi, Lahore. Please.
Thank you for that question. Okay, so, if we look at the latest census, came out in, what was it, 2024? 2024. I'm looking at Ali because he's always on top of this information. So I think that's a bit of a pejorative, that the idea that rapid urbanization is exploding cities. I mean, this talk of explosion is always kind of big cities, big metro. Yes, I mean, there is always a tipping point. We know about the tipping point. It goes back to, what many urban scholars have talked about, like Saskia Sassen and others for decades, that every city has a tipping point. But we're beginning to see that in the context of big cities, and if we want to see big cities, we can look at the Chinese experience also, that Delhi is a city of 25 million, Karachi is pretty much along the same lines, and it does keep expanding. But where the growth is actually happening, where the expansion is actually happening in cities across Sindh and Punjab is in secondary cities now, if you want to call them that, the non-metropolitan, the non-metropoles, beyond the metropolis, essentially. What can the Pakistani state do? It has tried to do some really shady interventions over the last 20 years for vote bank politics, to build new cities. Zulfikarabad was one of them, as I recall, right? I mean, shady politics, if it happens for those reasons, right? Again, it's a political economy question. Will it actually happen to control populations? Again, the next question that has to be addressed with that is, which I think is a deeper question, that what is the Pakistani state going to do, and if we can just kind of open up the state and think about at what levels, what is it going to do about secondary cities expanding in relation to the kind of climate-induced displacement that we are now also witnessing? There are structural dynamics attached to that as well. Climate change-induced displacement can be a red herring at times, but this is certainly what my colleagues and I have been witnessing across Sindh, for instance, because this is largely where we focus, that with every flooding event, we see waves of populations coming, not so much towards Karachi, but actually first port of call are secondary cities, like Jacobabad and others. Some go back, some don't go back, because going back isn't always a choice. There's nothing to go back to. So I think climate-induced displacement, pivoting on deeper structural dynamics that have to do with inequalities, post-colonial interventions, colonial interventions, this is a much deeper conversation in terms of expansion and population explosions. And then, of course, infrastructures are overwhelmed everywhere, and in Sindh, Balochistan particularly so. So I hope that answers your
certainly,
question.
my apologies, I didn't mean to be pejorative. Really what I was asking is, would it make a difference? Would it help? But anyway, I think...
Did it help with Zulfikarabad? I'm not sure. So, kind of.
I defer to your expertise on that one. So, the audience, do we have... I'm sure we do. Yes, Dr. J.
Right, so I have one question for each of the speakers. So thank you for these great presentations. So Dr. Noshin, my first question to you is that I believe, if I'm correct, that you did this survey in 2022, right? So over the years, do you think, because you mentioned that 50% of the people were aware of the heat waves and early warning systems and what needs to be done, do you think over time has this changed? Because that's what we've been seeing, more media engagement and more awareness campaigns being done, more NGOs and being involved. So do you think that has changed in the positive direction? And if not, then what more needs to be done to prepare our communities better? My second question to Dr. Marin here is that we talk about health system resilience, and of course one of the major pillar for improving resilience is building the capacities of healthcare providers and making them aware of what needs to be done because of the health condition of these emerging climate threats. And one of the major components are our lady health workers, community health workers, and the services that we provide at the household level. So what is being done or planned to build up their capacities to cater to these emerging challenges? Thank you.
Thank you for that question, Jay. And yeah, absolutely. So 22, 23, 23 years onwards, media alerts, media reports, initiatives on alerting people to heat waves, I think definitely there has been a difference. What would it look like if we were to repeat that survey just on that question today? I'm not sure, not entirely sure. Maybe it would look slightly better, depending upon where we repeat that kind of a survey in terms of those locations. But I think that at a much deeper level, there is also a problematic attached to the consequences of these heat wave alerts, because the heat wave alerts, which pertain specifically to acute heat moments, which are heat waves, don't then do much beyond the heat wave event, right? And in the heat wave event, people are told you must stay indoors. And we also know the risks of overheating in terms of the indoor environment. So there is a complexity attached to how much of a difference those heat wave alerts make in people's lives. Should people stay indoors? What's actually happening indoors? When it comes to infrastructure crises, especially women, we know we're doing a small study right now on female domestic workers, those who work on piece rate basis within Karachi. And we know that irrespective of heat waves, even during chronic heat seasons when summers are longer and temperatures are high, and humidity factors are especially high, and load shedding and electricity crisis, water scarcity issues are ongoing, productivity falls. And women say they cannot work at all in certain weeks and in certain months. So, and this is also then related to the built environment, which becomes a very important mediating factor. So those alerts might make a difference very briefly in people's lives. It probably does impact fatalities, but then you are a medical scientist and you also know much better than I do that heat impacts are very stealth-like, and what actually happens to the body in terms of continuous exposure to extreme heat is yet another story. So maybe that 50% might look slightly better, but then there's a much deeper story behind that kind of data. And so there was another part of your question? Oh, that was it, yeah.
Working now. So thank you for the question. I'll take what you were talking about, impacts of heat. So Jai, you know that we are mostly working on the acute, the impacts of acute episodes of heat, but what we are not looking at right now, which we need to proactively look at, are the chronic impacts of heat. And that's something that is really important, especially in the global south. So there is a mind shift, thought shift towards looking at the chronic impacts and kind of moving away from the acute impacts of heat. So to answer your question, lady health worker, community health workers, they are the first line for any sort of medical intervention and during disasters as well. So the government of Pakistan, while I was at the ministry, we worked with Pathfinder International. We trained about 800 community health workers, lady health workers, as first responders in cases of any sort of a disaster, so that whenever, and especially to women, so that their sexual and reproductive health needs which are unmet during any sort of a disaster, which we saw during the floods in 2022, can be met by the workers who are within the communities and who these women are very comfortable with. So we developed curriculum modules for them in their local languages, very simple, for these women to understand, but then also for the women and the communities that they're working with. So we developed it in all these different languages. That was one thing we did. The other thing is, again, with Asian Development Bank, they're supporting us. So we are developing a curriculum for the Nursing Council to be taught as part of their studies, so that, you know, they are more, they adapt to how to respond to climate emergencies in future. So do you want to ask another? That, I think I answered your.
Great. Thank you very much. Are there any other questions? I think there's a question from the audience there. So.
And if I can make a comment afterwards.
Thank you. Less of a question and more of building upon Dr. Zulfikar's intervention, changing the working hours, like we do in Ramadan. As the temperature accelerates, it becomes increasingly hard to protect lives and livelihoods during bulk of the daytime. And one additional reasoning I wanted to draw your attention is not only increasing the daytime heat, but very rapid decline at the nighttime temperature. I don't know if I'm saying it right or not. Declining meaning the minimum temperatures don't go as low as they're supposed to, so next morning people are not rested, especially in a country like ours where electricity supply is erratic and not very reliable and plus expensive. So therefore, the night temperature studies have also become extremely important. And just a comment, maybe, Nosheen, you can comment on that.
Thank you, Ali. That's an incredibly important point, the whole nighttime warming issue, which also has to do with the urban heat islands. And it's quite interesting. So in our 2022 survey and in our ongoing conversations in other parts of Karachi and now increasingly in Jacobabad also, women often complain a lot of sleeplessness at night, especially in low-income and informal settlements where housing materials simply don't have the capacity to be able to mitigate the nighttime warming temperatures. So, and then the kitchen and the heat that emanates from the kitchen, which was a very important point that I was trying to make in that slide, also becomes a part of that whole nighttime overheating, and then sleeplessness, not sleeping at night, and then waking up and then in the morning, the body feeling sluggish. So I think that there are increasingly more and more interventions on initiatives being taken globally on studying the relationship between nighttime temperatures and sleeplessness. And some really, really good studies out there, ongoing projects by colleagues over at King's College and in various other universities across the US and parts of global urban south also. So, and that really has to be taken into consideration when we talk about risk mitigation and all of that, definitely. I just want to make one point. And so I've been having a lot of conversations with climate scientists, and it's kind of an existential crisis climate change presents. So geoengineering is going to be the future, essentially. And it sort of, when I think about the kind of geoengineering dynamics that are going to be unfolding very, very fast, my other hat is with IID, so I do advocacy at IID. I work on climate justice issues. So the COP30 has been declared a failure, essentially. And if anything, the fossil fuel companies are back at the forefront now. It's been a win for them. So geoengineering is going to fast become the solution. And what does this mean? So I was asking one of my climate scientist friends that give me one example of what Pakistan can do vis-a-vis geoengineering. So he said, well, you know, Pakistan may very well be in a very powerful position today to be able to buy the kind of technology or invent it to fire sulfates into the air and the atmosphere to bring down high temperatures and to essentially create a kind of a safety zone vis-a-vis solar exposure. And then various other kinds of interventions. So what does this actually mean in terms of risk mitigation? It means, perhaps in the long run, absolutely no going back on fossil fuels whatsoever. So Danielle's work is so important in that sense. You know, it reminds us, you know, in terms of our fossil fuel-fed freedoms, that we are so locked into the entire fossil fuel lived experience that if geoengineering becomes the primary mode to move us forward in terms of our survivability, then risk mitigation becomes a moot point, essentially. On the other hand, there's no doubt that oceans will become more acidic if we continue to use fossil fuels. So that conversation with climate scientists has increasingly led me into an existential crisis in terms of thinking about my own work, that in terms of all of this that we are doing, all of these conversations that we are having, to what extent is this really going to make a difference, especially for a country like Pakistan, who might decide, I mean, the military might decide, because it has the power to do so, forget about all of this, right? We talk about devolution, we talk about all of this, let's just get that technology that's out there, and we have the capacity to change things. And geoengineering becomes the primary solution. So I think that this conversation also needs to be a part of the broader conversation on what we mean by solutions, because I think this is the future, and I think that the future has already arrived on this front.
So can I make one point? We were just talking about changing the work hours whenever there are heat warnings. That's just one part of the equation, and that you are just catering to the outdoor workers. As we just spoke about urban heat islands, you have a lot of women inside the house. Okay, they're not outside. So changing work hours will just cater to one segment of the society. But then there are vulnerable population, elderly, children. Then there are a lot of people who are on medication that during a heat wave changes the thermoregulatory the mechanism of their body. So yes, that is one answer to the bigger problem for one section of the society, but does not address the problem to the whole of society. So we need to have an approach for the whole of society. And built environments and the role of architects in how we build the environment in future is more important, I guess.
Great. I think we have a question up front from Jeff.
Thank you. This is a question for Nosheen. It's a bit technical, because I noticed in your charts on respondents to heat, feeling hot, tin roofs were lower than wood and bamboo. You mentioned that, but your final conclusions were the opposite. So I was just wondering, first of all, did you take housing design into consideration, and whether it's just a roofing material? And secondly, when you're talking about correlation, is this statistical?
Yeah, the correlation is statistical, definitely. But the data is still being cleaned up. So what I shared with you is still very, very preliminary. And there are some very serious contradictions embedded in the way that this initial data has been produced. So going forward in the next 3 or 4 months, I'm actually hiring someone who is dedicated quant, really, really super amazing in terms of handling this kind of data and cleaning it up. So, because it is a huge amount of data, so that we can revisit precisely these kinds of contradictions to get a much clearer understanding of what those findings actually mean. So yeah, the statistical correlations are definitely a very important part of it. Did we take housing design into consideration? To some extent. Because it was such a massive survey, we didn't especially have the time to go into the level of detail that might have been necessary. We would have had to maybe do a repeat exercise several times, or perhaps in a second year also, so we couldn't really get to that, and it was a question of money as well. And money always makes a difference. So this, what I presented, is actually very, very preliminary data. And over the next several months, what we're hoping is that once we've cleaned it up and we've kind of really gotten to the heart of what these contradictions are telling us, we can make this data available for the entire public everywhere, and then they can use it for whatever purposes and give feedback and critique it, so we can keep on working on this as we go forward. So I'm sorry to be so amorphous in terms of answering that question.
Great. I think we'll have Zulfi do the final question.
No, I mean, I just wanted to
there's
make
another question.
some remarks because, I mean, I think it's important to put this in context. Lots of students in the audience. So first of all, I'm delighted that you're going to put this data in the public space. I think it's important for people to look at information and then parse it and have alternative views also. I mean, correlation isn't causation, as you know better than I, of course. You know, and lots of association data has to be looked at in the context of how the information was collected and what is plausible and what is frankly implausible. What I do want to say about geoengineering, since you've raised it, and not only you, I mean, you know, lots of people are talking about this at the moment. I think the important thing to remember is that many of these technology solutions that people are talking about, I mean, Bill Gates has come out with a statement to say, I mean, why are we doing all of this? I mean, people have lived with climate change for a long time. They're going to adapt and go on and live their lives. I think it's important to remember that it is a threat multiplier. And the kind of climate change that we are seeing in recent years isn't the climate change that we have seen over the last several centuries. I mean, there's an exponential increase in the last few years in terms of, you know, extreme heat events. I'll show some data on that later today. Last year was one of the hottest years on record. Every year we seem to be breaking those. And as cities multiply, as we get into these large mega cities, they have their own dynamics, as your work shows also, that is very different from what things have been in the past. So this notion that people will just adapt and just live their lives and it will not impact on things substantially is completely incorrect. I think what will happen is with technology and all, and solutions that people are beginning to talk about, some of these disparities in terms of who benefits from those technologies and tools will increase, will dramatically increase. We had a consultation with the World Health Organization a few years ago in Dubai, which was all around extreme heat and what it impacts, and the representatives from EMRO kept talking about air conditioning as a solution. You remember that meeting, right? Absolutely. It was an incredible meeting. Yeah. Here is a public health group that is talking about air conditioning as a solution for the future. So my last point on this is the one thing that we have as an unknown is whether we can modulate whether local or regional climate by some of these technologies that people have been talking about. Insofar as I know, in urban modulation of environment, whether it's heat or air pollution in particular, this has all been possible because of feasible local solutions of the kind that we have known for a while. China was able to clear the smog out of Beijing. Mexico City was cleared, not by any sophisticated solutions, but time-honored basic things like improving vegetation, cleaning air, getting smog-producing industries out of the system. So for Pakistan, I think it's extremely important that we look at what is really basic knowledge and what is basically information that we've had for a while. Thank you.
Thank you very much. I think we'll have the final question here, and then we can break for tea.
Thank you so much for your wonderful presentations. So we have planned to conduct our research in Thatta and Matiar districts of Sindh, and it's basically perception study, perceptions of climate change. So you did your study in summers, but ours is we have thought to conduct the study in somewhere in Feb or March. So it's mostly about floods and heat. So I would really like your opinion on this. Would you really think we would be able to capture the true perceptions of the local communities? And of course, because we are also aiming to involve the health system stakeholders like LHWs, DHOs, and everybody involved in the policy making. So do you really think we would be able to capture the true perceptions of heat and floods in those seasons?
I think why not? I mean, depending upon how you pose your questions and what your objectives are at a deeper level, why not? There are always ethical issues involved, for instance, in intervening at a point when people's lives are most impacted and there's an imminent crisis. So is it wise to go and engage with people right after a flood or right after an extreme heat event? Not necessarily, because that might be the worst point of time in their lives where it's perhaps very difficult for them to talk, to be part of a larger, I mean, there are ethical issues involved with that. So, and I think that we've come to a point in Pakistan now where extreme events, compounding events, one after another have become so pervasive. And the parameters also with that keep shifting in terms of people's lives, those who are poor and vulnerable. People's memories don't fade necessarily, they don't forget, and they're quite well-versed and adept at being able to explain and articulate how these compounding impacts are affecting their lives. So if you engage with them in the month of February, I don't think that denudes or lessens the importance of the kind of objective that you're seeking. And I think that any kind of intervention is a good intervention on this kind of topic. I think it bears fruit and becomes part of a much bigger dialogue, a more productive dialogue that should hopefully have an impact on policy at the local level. We have a lot of talk at the national and provincial level on adaptation, lots of plans being churned out. When it comes to action and dialogue at the local level, that's where it fails the most. So I applaud you in terms of what you are doing, and I look forward to eventually reading what you produce. I think that is just fantastic.
Thank you so much.
Wonderful. So I think with that we can conclude this session, and I'd like to thank all of our three speakers, the two who are here in person in particular, for a fantastic discussion. Thank you to the audience for wonderful participation, and I hope you enjoy the rest of the conference. Thank you.
Thank you very much, Dr. Leon and Professor Kermani, for chairing this excellent session. We also extend our appreciation to all our speakers for their insightful presentations and to the audience for your thoughtful engagement. Before we conclude this session, may I kindly request our two chairs, Dr. Leon and Professor Kermani, to please come up on stage to help present tokens of appreciation to our speakers, Dr. Nosheen Anwar and Dr. Mehreen Mujtaba. Yes.
Sorry, I didn't know I was. Oh, please. Thank you so much.
Now, I would like to invite Syed Mohammed Suhail, who is the Chief Operating Officer at the Aga Khan University Hospital. He has worked extensively with the Aga Khan Development Network and the Aga Khan Agency for Habitat for the last 2 decades. I kindly request Mr. Syed Mohammed Suhail to please come up on stage and present tokens of appreciation to our chairs. Ladies and gentlemen, we will now take a tea and coffee break. Please reconvene in the auditorium at 11:15 sharp, as we will begin session B promptly at that time. Thank you.